love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. On this week's edition of Health Matters, I'm Chevany Nisbet, your health educator from the Health Promotion Unit. And I have with me Dr. Charlie Rouse. He's our visiting cardiologist. And I will now turn it over to Mr. Rouse, and he will tell us a little bit more about why he's here and what he will be doing for his visit.
Good evening. I'm Dr. Charlie Rouse. I've been asked to come to Davis to participate in evaluating the health as it pertains to cardiovascular illness. And when I say cardiovascular illness, I'm speaking specifically about strokes and heart attacks. We've had the opportunity to do some screenings in various clinics and centers around the area and to try to make a determination of how prevalent diabetes and hypertension is, whether or not there's issues with being overweight, and etc. So part of our mission is to try to educate and diagnose and early treat cardiovascular illnesses and diseases that may affect individuals' longevity. We have held several clinics in the past with individuals that I've seen last year, and we've also done quite a bit of screenings with respect to diabetes, obesity, hypertension, body mass index, and etc.
So, Dr. Rouse, what was done when you were here on your last visit?
So, on our last visit, we got the opportunity to come in, go to several centers around the area, health centers, and held a cardiovascular clinic as well. In addition to that, we donated some equipment that will be utilized to screen individuals that have potential cardiac problems. For instance, treadmill stress testing, echocardiogram, and defibrillator. The echocardiogram is an ultrasound that gives the opportunity to look at the heart squeeze and the valves and things of that nature to determine if somebody has some sort of illness in that regard. So we did quite a bit of screenings. I can't remember exactly the numbers of centers that we went to, but quite a bit of screenings and quite a bit of information that we gather. What we're trying to do is gather that information, analyze that data, and then give it back to the Ministry of Health so that they can utilize that information to determine where the issues are and to determine what kinds of further treatments and things need to be done to make the citizens of Nevis more healthy.
Wow, and we really appreciate that.
Absolutely.
As one of the donations. Those are really helpful. And so your findings in terms of like, I know you say you don't have numbers, you don't have exact numbers, but what did you find in terms of heart problems in Nevis, heart issues in Nevis? Is it at a high or low, in between?
Yeah, I certainly think that that we have found quite a bit of heart disease here. And when I say heart disease, I'm speaking specifically about strokes, blockage in the heart arteries, heart attacks. Equally more important, though, is the fact that you have a high incidence of diabetes and hypertension, and those are the kinds of diseases that lead to people developing cardiovascular illnesses. So we were able to screen quite a bit of men and women in your area. Unfortunately, the men don't come out in the numbers that they should like the women did, but the data held true across the board. That is to say that about 30% of the individuals in whatever center we went to, or whatever church, whether or not it was Shiloh Baptist or the Franklin Brown Center, whatever center we went to, the interesting thing about it is about 30% of the women had high blood pressure and 30% of the men had high blood pressure. Wow. The data was equally true for those who had diabetes. Probably under 30% had diabetes in terms of men population, but the female population, there was just under 50% of them had diabetes. So I think that to answer your question, whether or not there's a problem, absolutely there's a problem, and whether or not there is any opportunity to improve or to treat or diagnose or to make the citizens healthier, absolutely there's an opportunity to do so.
Okay. So as part of the clinic, sometimes you give advice as to what they can do to lower their chances or to improve upon those who already have the disease.
Sure. Quite frequently, in some of the sessions that we did, we would go in and give a lecture, have a dialogue between myself and the citizens. And an opportunity to answer questions. I'd give out some data with respect to what diabetes is, with respect to what hypertension is, and then we'd have that dialogue, and those sessions would probably last about 2 hours or so. But very good information come out of that. One, in terms of eating habits, two, in terms of exercise habits, three, in terms of being compliant with taking your medications like you're supposed to. I mean, I was amazed at the number of people who stopped taking their medication because they had some side effects or had some issues or whatever the reason was, or some of them that don't take their medication on a regularly scheduled basis.
Right.
And those things lead to problems within themselves. If you're taking medicine and it's not effective at controlling the problem that you have, then you're not doing a service to yourself.
That's true. That's true. And we have a lot of that because a lot of them are older, or the older population who don't really like taking medication, right?
Yes, I found that some in the elderly population, but surprisingly, it was more in the younger population.
Really?
Young men, particularly. There were a number of young men that had high blood pressure, and some of the medications, unfortunately, cause issues with sexual dysfunctioning and that kind of thing. And so they wouldn't want to take the medication because it affects them in that kind of way. And, my counsel is that, look, if you're not taking this medication like you're supposed to, then you run the risk of having a stroke.
Sure.
You run the risk of having a heart attack. You run the risk of dying. And then I try to encourage them to engage in some healthy habits that may help them potentially get off of some of the medication sometimes. Not always, but in some instances with significant weight reduction, cutting back on your salt intake, eating properly, exercising, you can actually reduce the amount of medication that you're taking so that it doesn't cause all of those side effects that sometimes people get.
Okay, that's good. And did you get you would say you got a good turnout in terms of people coming to the clinic?
Yeah,
in your opinion?
In my opinion, absolutely. I mean, there was one center, I thought we had over 60 or 70 people there.
Okay.
Always, as a health practitioner, you want to see more.
Right.
And so, and particularly the men. I know I keep saying that, but that seems to be a problem universally across the world, not just unique to Nevis, in that men don't seek the health evaluations and treatments that they do. And unfortunately, what happens sometimes, by the time they present to the hospital, by the time they present to the doctor, their disease is so advanced that they have significant damages to their body that could have been detected early enough and could have been prevented potentially.
And those that do come out, are they cooperative?
Yes, absolutely. I'm just interested in having those kind of dialogues and learning more about your culture so that I can understand what the issues are. Yes, they're very cooperative, very interactive, very inquisitive,
yes.
and I think provided me with a lot of insight as to some of the issues, especially when it comes to dietary changes and dietary habits. In terms of preparations, what we ask people not to do, if we can get the screening done early in the morning, we ask people not to eat or drink after midnight, because that gives us the opportunity to really get a good, accurate reading. And that holds true for any beverage or a stick of gum or piece of candy. Nothing to eat or drink after midnight means nothing to eat or drink after midnight, so that we can get accurate information. And then once we get that accurate information, of course, we look at it, have a dialogue with the individual person one-on-one if there's some abnormality that we find, and then try to seek to get them back to their healthcare provider.
So that nothing to eat after midnight goes for people who are diabetic. Sometimes they need to eat at a certain hour and.
Yeah, so there's a couple of ways of potentially handling that kind of issue, but nothing to eat or drink after midnight. We try to get the screenings of those potential people those individuals who are diabetics early enough so that they can go ahead and eat their breakfast and take their medications on schedule. And our main concern, or one of the main concerns that we have, is individuals who are not knowingly diabetic or who don't knowingly have high blood pressure. And evaluating them, and particularly the younger populations, because the earlier that we can capture this information, the earlier that we can detect a diabetic, the earlier that we can detect that you have high blood pressure, the more significant impact that we can make, and we can potentially prevent you from having a heart attack or stroke or losing limbs or being on dialysis or having kidney failure or any of those kind of bad things that come along with both of those diseases. I'd say that, I think that one of the problems with diabetes and hypertension, particularly hypertension, it's both of them are considered to be silent killers.
Mm-hmm.
So many times a person is walking around with blood pressure 200/110 and have no knowledge, and by the time they reach the physician or the healthcare provider, they've started to have what they call end organ damage. That means a stroke or a heart attack or blindness or kidney failure or limb loss and things of that nature. Mm-hmm. So if you have any of those kinds of diseases in your family, then it's important for you to get evaluated early on. If you have, we call it the 3 Ps in diabetes: polyphagia, polydipsia, and polyuria. If you're drinking a lot, if you're eating a lot, and you're going to the bathroom and peeing a lot, that may be an indication that you may be diabetic, particularly if you have a family history of that. And so it's important to get that kind of evaluation done.
And what age would you say be the youngest for you to go and start getting screening?
Interestingly enough, in your population here, you have quite a bit of young people having diabetes and high blood pressure. And so, my counsel is the earlier the better. If you have somebody, a teenager that has some of these symptoms or issues, if you can evaluate them, make a determination that they have high blood pressure or elevated blood pressure, and let's say that that it's not to the point where they quite need medication yet, then maybe you can institute a behavioral modification program, which means exercise and dietary changes that may prevent them from going on being full-blown diabetic or full-blown hypertensive and having those problems associated. So I think as early as possible, I would recommend the evaluations be done.
Okay, well that's good, because I always thought it was a certain age, and I'm sure a lot of people think so, because as a young person you think you're 20 something, you're 30 something, you're not going to get it, so you don't need to go screening.
That's absolutely true, and that holds true, I think, universally of any country that I've been in. As young people we become or think that we're invincible, that happens to older people, but a lot of times what we've learned early on is that these diseases start when you're earlier, and they're affecting your body throughout your earlier years, and then when you become older, the disease manifests itself. But we see it sometimes manifest itself at early ages as well. So the earlier you can find out that you have some issues like this, particularly if you have family history issues, the earlier you can find out about hypertension, the earlier you can find out about diabetes, the earlier you can institute a strategy that may prevent you from having some of those bad problems down the road.
And so when will be your next visit to Nevis?
So our next visits will be in 2015. We don't have a date established as of yet, but what our plan is to do, as we did this past year, that is to come at least twice a year. Once we get the infrastructure, once we gather the data, once we get a team of additional team members, then we may come more often than that. But at least for right now, our plan is to do twice a year, and we haven't set the date in 2015 when that will be.
Okay, that's fine. And when you come, you normally bring out like your team of nurses and specialists?
Yes, we bring individuals, some of them that are nurses, some of them that are just interested in making a difference.
Okay, that's good.
And some of them that have social service backgrounds and things of that nature. And so it's been, I think, a wonderful exchange of information. And I always tell people we're not trying to come in and be the savior. We're just trying to establish a relationship and provide services, insight where we may be able to do so. And that, unfortunately, that's just not dealing with healthcare issues only. It's dealing with social issues that may impact individuals as well.
I agree. So when you come twice a year, is when the first visit, is it like a follow-up the second time around when for the patients you would have seen the first time, or is just whoever wants to come on either visit? Do you always have follow-up sometimes? So
yes, we do have a follow-up clinic that we typically do. There are individuals that I've seen who have some cardiovascular problems, who've had open heart surgery in different countries, who've had valvular abnormalities, who have atrial fibrillation, a rhythm disturbance of the heart, who have all kinds of cardiovascular issues. So we get the opportunity to follow them. The plan, the thought process is to everybody that we've seen, we collect data on.
Okay.
So the thought process is at least to get those individuals to come back to the respective centers the following year so we can determine if we've made a difference or not. If we told them that you should engage in this sort of exercise program, you need to lose weight, you need to make sure you're taking your medication, we need to make sure that your blood sugar is well controlled. We want to know if any of this information that we're providing has made any difference or not. So we want those individuals certainly to come back to the centers. But in addition to that, anybody else that wants to come out, welcome to do so. It will be nice if we get the whole island to, to be evaluated. So.
I wish. So Dr. Rouse, I would like to thank you for being here for the interview, and thank you for coming to the island and helping us so greatly. Really appreciate it. Before we go, is there anything you'd like to say? It could be advice, it could be anything you'd like to say about it.
No, I'd just like to thank the people of Nevis for opening their arms and allowing us to come in to be a part of their health care. I'd like to specifically thank the ministry for allowing the healthcare workers from the various centers to come out and assist us in blood pressure evaluations and diabetes assessments and those kind of things. And I think we're looking forward to a long-lasting relationship. This is not a one-time thing. Right. Hopefully we, over the years, will be a part of making the health care of Nevis individuals better, and hopefully we'll be able to make a significant difference.
Okay, thank you. And just a little side note, what do you think about Nevis, the island itself? I know you've been coming here for a while.
I have. I love the friendliness of the people. I have been very few places in this world that I've had this kind of warm reception. Okay. I mean, and when I come back, it's almost like I've been gone away from home because people are welcoming me back. And so that's a really nice feeling. It's very cozy. It's a very beautiful island. And I plan to come at least some point in time in vacation here.
Awesome. That's good. That's good. And where are you from originally?
I'm originally from Waynesboro, Georgia, but my practice is in Carrollton, Georgia, just about 45 miles west of Atlanta.
Okay. Yeah. Okay. All right. Well, that's good. It's always good to have you on your team, so thanks again.
Thank you.
And this has been this week's edition of Health Matters. I'm your host, Chevany Nisbet, health educator from the Health Promotion Unit. Thank you for viewing. The fruit of the week is watermelon, and watermelon is a good source of vitamin A and vitamin C.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.